Did you know nearly 40% of young adults are uninsured? Right here in Texas, at Blue Cross and Blue Shield, we understand the importance of engaging young adults in health care. That's why we're proud to join efforts on public health care forums like the following.
Please join me in welcoming Jenny Gold, Erin Hemlin, and Dr. Vivian Ho. Jenny, Erin, thank you all for being here. Nice to see you.
You too.
I want to begin by trying to quantify the challenge before the healthcare system or the healthcare industry, by which I really mean the apparatus around the Affordable Care Act as we attempt to bring young people into the system. I commented to Jenny that depending upon which source you consult, the numbers of young people either eligible or necessary to get into the system varies. I've seen as little, Jenny quoted to me a number of just more than 7 million who need to get into the system to make this thing work. That's maybe a low-end number. I've seen as much as 32 million. We need to bring 32 million young, healthy people into the system, at least in part based on the economics of the Affordable Care Act, to make the thing work. Dr. Ho, you're the economist, you're the health policy expert. What is your sense of the stability of the system if young people don't get in?
Well, if we have very low enrollment of young people, I think we're going to face extremely serious problems. The reason why we had an individual mandate in the Affordable Care Act is because the minute you provide subsidies for everyone to get in and get rid of, everybody's allowed to enroll regardless of pre-existing conditions and all these issues, you're going to have a bunch of new people in the system.
Right.
And you need some other people to counterbalance that. I haven't heard anything about these particular estimates about 7 million versus 30 million. So how many of these relatively well people do you need to get in the system to make the health insurance premiums stay about where they are, hopefully even lower?
Right.
Over 30 million just doesn't sound right to me.
Yeah.
My understanding is we're just under 50 million people uninsured. And
so how can it possibly be? Well, it may be that, this is of course a political issue, as almost every issue is a political issue, and the people who wish this to fail may have their thumb on the scale.
So the 7 million was actually the number of single uninsured people in the 34 states who are not running their own.
So in fact, that number is probably too low if you're trying to quantify the magnitude of this, and the 32 number is probably too high.
The number I've heard is that in the first year of enrollment, the government expects about, or hopes, 7 million people will sign up, and of those, they want 2.7 million of them to be young and healthy.
Right. Let us just say, for the only time on this panel, how's that whole signing up thing going? Not well. Right. That's the challenge. It's an additional challenge, right? It's persuading young people to do it. Jenny, as you've covered this, you've obviously come into contact with a lot of the kinds of people we're talking about today. There are a whole range of reasons why young people have said they're either not inclined now or not inclined ever to sign up. Kind of give us the survey of what you've heard.
So I just want to start by saying I don't think, for the most part, young people don't want health insurance. I think this whole idea of young invincibles is a little bit of a myth. Kaiser Family Foundation.
You'll get a chance to knock back at that ball in a second, I promise. Okay, yeah.
Kaiser Family Foundation did a recent poll and found that about 7 in 10 young people actually think health insurance is a very important thing and they want to buy it. The reason they're not is because it may be too expensive or it may not be somehow not available to them. Those are really the reasons. So
cost and availability are at least 2 reasons why, when the people who do say they're not looking to do this, that's what they cite.
There's certainly then the other quarter who maybe we could put into this young invincible category. I've heard them described as the bros or many other sort of derogatory terms for young people who just don't think health insurance matters. I was on C-SPAN the other day and a young person called in and said, I don't need health insurance, I have life insurance. So there seems to also just be sort of a lack of education and knowledge about exactly what health insurance means and what it's for. So
now I'm less concerned about health care and more concerned about the future of our country. That's how that goes. Erin, I don't really think, in truth, that Jenny is pushing back on the whole concept of young invincibles, but obviously you all believe that there is such a coterie of folks.
Well, actually, we completely agree with what Jenny just said. We think the young invincible term is kind of a misnomer that we kind of use it ironically when we talk about young people. But we did a poll in 2012 that said almost the exact same thing. 71% of those that we polled said that they didn't have health insurance because they either didn't have access to it, or they didn't have an affordable option, or they were denied for a pre-existing condition. Yeah. Only 5% that we polled actually said they chose not to have health insurance.
Yeah. So has this all been overblown then? You know, I mean, there have been a spate of articles and a spate of conversations in the media, on television, radio, wherever, over the last couple of weeks saying that this is by far one of the biggest problems with the system, is the assumption that all these people are going to get in. To Dr. Ho's point, we need them to get in to offset the more expensive end of the spectrum, and they're not going to get in, or they're not getting in. Maybe that's been overstated.
Well, I think there is still a very big, severe lack of education. So I think that's a big part of the problem, is just a lack of health insurance literacy, as well as just ACA basics. So that's why we do so much effort on
outreach,
education. Yeah. Right.
Let's come to that outreach in a second, but I want to go to the cost point first with Dr. Ho that Jenny brought up first. So this is a big flashpoint in the conversation. You have roughly half. I mean, I'm just sort of making a flyover analysis of this. Roughly half of the conversation about the ACA and young people is too expensive. But then there's another version of this that says, no, it's actually quite cheap. There was a USA Today article out this week, and quite a bit of discussion of how 46% of the people who are in a certain young group, age group, would have access to policies after the subsidies for less than $50 a month. That 66% would have access to policies for less than $100 a month. That actually does seem not that expensive. So is cost a legitimate barrier to entry here, from what you can tell?
I don't think cost is too much of a barrier for a large part of this population, particularly those who are going to qualify for some sort of subsidy. I think I agree with Jenny and Erin, though. I think it's a lack of education and understanding of how important health insurance is and how much it's going to financially protect you.
Yeah. You're not sympathetic to the idea that for young people who are healthy and don't think they're going to need to go to the doctor, it's a choice between spending that disposable income on this or something else that might be more immediately pleasurable to them.
Oh, okay. So there's a difference when we're talking about, say, $50 to $100 a month, as opposed to a little bit more than that. Because I do think for some of these people, you know, I've seen examples of stories of young families where they chose to spend all of their discretionary money on tuition. For someone to get a degree. And so I understand, and then unfortunately the person who's in school actually suffers a heart attack at a very young age. And then they're in trouble. So it's, you know, it's, for me, I think that's a hard decision, but it's a way of trying to explain to these people, you know, economists have beliefs in overlapping generations models. So you buy these types of insurance now to protect and someone's going to help protect you later on. You know, so in a sense they feel, why do I have to subsidize the illnesses of other people who are going to get sick? And well, you are going to get older, and at some point you're going to need that protection as well. And that's the way we've structured Social Security in this country. That's the way we've structured Medicare, and it's just a way of trying to move that so that's the way we sort of we fund health insurance in this country too.
And remember that when we're talking about young people and costs, it really varies. It depends on where you live.
Could you explain that for the benefit of the audience, kind of how that?
Sure. So rates are set state by state and actually much smaller region by region. So you may have a place like Texas, actually plans tend to be fairly inexpensive compared to a state like Maryland where they're very expensive. If you earn under 250% of the federal poverty level, sorry, I don't have that number off the top of my head, but
28,000.
28,000, thank you, for an individual. 28,000 for an individual. Then you have a maximum you can pay. It's, I believe, like 8% of your income. That's the maximum the government's going to make you pay towards your health insurance. So what that means in practice, and I think there was a policy paper out from the Texas Public Policy Institute recently that suggested that a lot of young people were going to get a subsidy that was like $8 a month, which doesn't seem like much of a subsidy at all, but it's because they're trying to sort of even it out. So everyone's going to be spending about the same amount, that percentage of their income. That means that people in Texas aren't going to get the subsidies that someone in Maryland is going to get because the plans are just more expensive. But the overall point here is that it depends very much on how much you make and where you live. Young people also have access to catastrophic plans. Very young people, I believe it's under 30, so that's another option for some people.
Jenny, I'm looking at this NPR quote that I pulled. I heard an article about this subject on NPR a couple days ago, and I heard this quote that I couldn't believe. I went back to look at the written version of the story to be sure I heard it properly. A woman was quoted as saying, "I'm super healthy. I rarely go to the doctor, so to pay over $100 a month for something I rarely use seems crazy to me." That seemed to me to be the distillation of what, in some ways, we're talking about, that people don't appreciate the concept of insurance. The whole point of insurance is not that you need it, it's that you may need it. Is that a big hurdle to get over?
I don't know. I mean, I have to remember that you maybe have been surprised about that quote, and the reporter may have called 100 people and one person said that.
Journalists. That's the problem with journalism, right? They go looking for something and they knock out the first 99 and then they end up using that.
So I think it all depends sort of what is our idea of affordability. It's called the Affordable Care Act, but we don't have numbers yet to determine, do people really think this is affordable? Are they going to sign up? There have been so many problems with the website. We really don't have a concept of how many people are going to actually sign up. And a lot of people, especially young people, wait to the last minute to do things. I think that's a totally legitimate point, especially when you try 3 times and the website shuts you out every moment. So we don't really know how many of these young people are going to sign up or not. $100, I think you had quoted maybe 70% of people are going to be eligible for
100 or less, about 66%.
66%.
Right. Yeah.
You know, 100 or less, maybe that is affordable for people. I think it's going to depend.
Right. Erin, what Jenny just referred to about college students or young people being late to do things just as a natural state of being was validated today by no less an authority than Jay Carney, the president's press secretary, who on Morning Joe was defending this very question. You know, well, why aren't more young people signing up? And he said, you should have seen me in college. I waited until the last minute to do everything. That's the nature of young people.
And not just young people. Who does
true,
that?
well, hello, true, I agree.
Their employer
right.
coverage.
But for purposes of this discussion, there's some validity. I think anecdotally we can say it's
definitely
something legitimate about that.
That idea is supported too by what we saw in Massachusetts. I think they had the hugest
Talk about
surge.
That,
yeah, in the last 2 months. They had like an 11-month enrollment period. Is that right?
Yeah.
Something that was very, very long, and everybody enrolled at the last minute.
Right.
So I think we'll probably see something similar, probably especially with that young 18 to 30 population.
Dr. Ho, I'm sure people in your classes turn in their papers early, right? They don't turn them in at the last minute. Has to be the case. Erin, talk about where Young Invincibles lands in terms of the attempt to persuade, whether it's on cost or on timing. Talk a little bit deeper about the organization than I did, and help us understand how you're trying to play in this space.
Sure, yeah, just to give a little background on how our organization got started. Our founders were students at Georgetown Law School in 2009, and were kind of paying attention to the debate over healthcare reform as it was happening in Congress, and kind of felt that young adult voice just wasn't being represented. So they started a website to kind of collect stories of young people, to hear what young people wanted in healthcare reform. And a lot of that culminated around the provision of staying on your parents' health insurance until the age of 26, which, as you know, was successful in the law. It was kind of our big first policy win, and that's what we grew out of. So we tried to stay true to that principle of listening to what young people care about and then using that to influence our policy positions. But from what we've seen through research from CMS, Covered California has done a lot of research too, on messaging that really resonates with this population, and a lot of it is the protection from financial ruin. Investing in your health as in investing in your bank account has been really, really...
That's been a big motivator. Dr. Ho, you agree with that? That's a motivator for people this generation.
Yeah, when I'm trying to get through to my students, first I realize, well, they're healthy and their parents aren't even old enough to be on Medicare. But when I talk about buying health insurance, well, suppose something happens to you, who's going to pay for it? Your parents are, and then it starts clicking.
Then they think, I can't saddle my parents with that.
Right.
Yeah, so they get that. The aspects of the Affordable Care Act that Erin referred to that have been most popular, at least in terms of the degree to which they're name-checked when people talk about the benefits of reform. Staying on your parents' health insurance till you're 26, no pre-existing conditions. From a health economic standpoint, how do those things tie into this conversation? Is the economic burdens on the system of pre-existing conditions historically have naturally given way to a conversation that we should no longer have pre-existing conditions?
Okay, so I think I understand your question.
Yeah.
I mean, the conflict I'm having in terms of the Affordable Care Act, you know, a friend of mine the other night on Facebook said, you know, I'm kind of tired of the Affordable Care Act. I want the more Affordable Care Act. And
the even more affordable, yeah.
Yeah, and so here we are trying to get as many people covered as possible and keep them from financial ruin, but on the other hand, we're also putting all these additional costs within these policies, the essential health benefits, and you know, sort of, I mean, I really worry, you know, should have we really pushed for all this mental health care? Did we really have to put all this preventive screening? Yes, it improves health, but it also raises the cost of premiums for everybody. It makes it really hard for the insurance companies to price their premiums. And they're all, I find insurance companies, you know, they're extremely conservative. This is the first time they had to do this. They had to price all these policies without any previous medical claims. And so what are they going to do? They're actually going to price high. I mean, and that's you know, it's sort of, I think that's kind of what you're seeing in some of these cases with some of these policies looking high. I'm hoping they come down, because I think once you get better knowledge of the population that's being covered, then the competition is going to step in and you're going to see those prices go down. But, you know, they have to price like this to start.
Right. Jenny, what is your sense of the whether it's pre-existing conditions or the stay on your parents' insurance until 26, how pervasive or popular are these features as you talk to people out in the world, leaving aside the question of who's enrolling? This is these are generally viewed as very positive aspects of this reform.
As far as people understand anything, those are the things.
Those are the things that they make the most sense.
Right.
Yeah, right.
And definitely, those are also the things that the president has hit over and over and over again. I mean, staying on your parents' plan till 26 is sort of the example of how this is actually working so far. So I think that's been extremely popular.
Yeah. You've mentioned a couple times the idea of education or outreach, messaging. One of the problems is that some people may not understand what's available to them in this new reform, or that some people may not know that there is reform, period. I have a hard time believing that young people who are so connected to the world through every conceivable device would have missed that there is this thing called healthcare reform that they have access to. But let's assume that the messaging job hasn't been up to it, and so not everybody is aware of all the particulars. How has the administration done at the attempts to message that they have engaged in?
Oh, I think they've totally bungled their messaging. I mean,
you don't want to hedge it all. You want to just
I don't want to hedge it all.
Totally bungled. Okay.
I think really no. I mean, I think they had years to sort of get out the message, and they didn't. And that's why when you do polls, you still have a lot of people who really don't understand this. When you explain to them what it means, when you explain to them the pre-existing conditions and the subsidies, each of those parts, with the exception of the mandate, are popular, but they don't really get it. And I completely think that the administration has bungled that. And you may really see low enrollment because of that and because of the website problems. But again, it's a little early to know because we don't know what's going to happen, you know, on December 31st.
Erin, the particular messaging interests me because you can message to the kind of broad population, but there's also the tendency to want to have sort of a subset of messages that are targeted to particular groups. There's an ad campaign that the Colorado Department of Health has now got on this week, where they've got somebody. It involves beer kegs. It's basically it's sort of the bro advertising that you referred to earlier, actually. Right. And the message is tap into your healthcare future. And I heard about this and I thought, this is surely a joke. This can't be serious. I mean, is that part of the problem, that there's a certain amount of pandering? Maybe the problem is that there's the wrong kind, not just there's no messaging, but there's the wrong kind of messaging to young people. It's kind of pandering and maybe putting them off.
I don't know. I mean, I haven't personally used beer kegs to try to entice people into health insurance.
Well, that's why you were invited, actually. Yeah.
I think that, I mean, there's so much education needed. I think any effort is probably a good effort.
Yeah.
I know there's research too by another group called Moms Rising that shows that moms are the most influential person on a young adult's decisions, especially when it comes to things like health insurance. So AARP has done a kind of cheeky campaign also where they had some like e-cards that they can send to the kids that say things like, I'll unfriend you on Facebook if you sign up for health insurance, and things like that, which I think is actually going to be a really effective campaign because it kind of depoliticizes it. It comes from like, this is just smart, this is what your mom's telling you to do. sign up for health insurance.
I also just want to raise the idea again of not looking at young invincibles or young people as sort of a monolithic group.
They're no more monolithic than any other group.
Right. I mean, all they have in common is that they're the same age, right? So you have some young people who aren't single at all. If we're talking about a population of 18 to 34-year-olds, a lot of these are families, are parents with young children, and they really want coverage. And I think the other really important thing to remember is that you also have them on opposite ends of the income spectrum. So you have the wealthiest young people who are earning like, $46,000 that are above 4 times the federal poverty level. They're not going to qualify for any subsidy. So they may really experience a rate increase. They're not going to get any help to kind of bring those levels down to a set percentage of their income. They were benefiting before from the fact that they were young, and the young men from the fact that they were male and were paying less. So those are the people that may really see an increase. And for them, it might be cheaper to pay the penalty and maybe not be worth it. And then
again, for the benefit of the audience, the penalty is?
Okay, so the penalty in the first year is $95, or I think it's 1% of income, but in future years it goes up a little bit to 2.5% of income. So if you make a lot of money, that's actually not a small amount. But then remember, there's also the people on the totally opposite end of the spectrum, those who are below 100% of poverty. That's actually a lot of young people. Young people tend to be the most likely to be uninsured, and they also don't have as much money. They're not far in their careers. They tend to be low income. So that's a lot of those people are under the federal poverty level. For those people in a state like Texas that hasn't expanded its Medicaid program, they're not eligible for anything.
Right.
That's a lot of people in a lot of states.
There's a gap.
That's right. So
for all the talk of the pervasiveness of reform and the fact that we're going to put all these mandates, all these people, the reality is there's a whole swath of people who are not going to be covered.
A lot of young people who are just going to be told, in a state like Texas, you are too poor to get help buying health insurance. And I think you're going to see a lot of young people in that boat.
Dr. Howe, I want to ask you about so offline from the question of young people, just the magnitude of the healthcare crisis, period. Since that's the overlay of any discussion about healthcare reform, is it assumes that something needs to be reformed because there's a crisis that's so large. We hear about how the costs of healthcare, generally speaking, are rising at a very fast rate. In states like Texas, once upon a time, public education used to be the largest percentage of the unrestricted portion of the budget. Now healthcare is rising to meet public education and is actually going to very soon race past it if we don't do anything. The problem is a problem, right? I mean, it really is. The system untouched is a problem.
Oh, absolutely. And when you look at the CBO's estimates of where we would have been without the Affordable Care Act, the predictions are not good either. And in many cases, employers would have had to pay more per employee for health care than if we didn't go through with this legislation. But you're absolutely right in terms of raising this point. Healthcare costs have risen faster than the rate of growth of inflation for years, just for more than I can imagine. And people are actually excited since the rate of healthcare growth has slowed somewhat since 2008, 2009.
Right.
And it's started with the recession, but even after that, the cost growth has slowed somewhat. It's still higher than the rate of inflation, and that's the problem. If we don't slow this cost growth, we're going to continue to have a problem with health insurance,
right.
Affordable Care Act or not, because higher health care costs raise the cost of premiums. Insurance companies, if they have to pay for medical care, more medical care, they're going to have to raise the cost of the premiums. And so I worry if we don't get the costs under control, we're going to be back in the same boat 10, 15 years from now.
So then that naturally begs the question of whether we in the state of Texas, and I guess it's a total of 26 states that have elected not to expand Medicaid, is that right? Have we made the correct decision? Are the economics of this sound behind the decision not to go that way? So what's the deal that's been offered to states like Texas is you're going to get 100% of your cost of expansion paid for a period of, I guess, 3 years. And then it goes down to 90%. And eventually, you end up getting the bill at some point in the future. But the amount of money that we're talking about in the period of time in which the federal government will provide those resources is not insignificant. It's a lot of money. We're in a state that likes to be first in everything. I'm not sure we want to be first in the number of our citizens who are uninsured, but we are. So are the economics sound behind the decision not to go this route from your perspective, Texas and the other states?
No, as a business person, the way the legislation was structured and how Medicaid was going to be financed is a horrible business decision for Texas. Essentially, what could have happened, we could have had federal tax dollars coming in to subsidize health insurance for our low-income population. And instead, we're going to be subsidizing Medicaid for California.
Right.
And it's a big hit to our business owners because they're going to have to pay a penalty if they have 50 or more full-time equivalent workers who don't have health insurance. They could have counted on a lot of their low-wage workers getting Medicaid coverage. And because of that, now they're going to have more of those workers not qualifying for health insurance that makes them more vulnerable to those penalties, which is going to cost them.
Of course, Jenny, the opponents of reform say that all this will do is result in businesses taking many of their employees down to part-time status so that they're not obligated to cover their employees.
That's right. That's certainly the business position. But
is that borne out by the facts, or is that mostly people saying, well, this will happen, we think, but actually there's no evidence that it's happened so far?
I'm actually not sure I would pass that to Dr. Ho.
So in the course of your reporting, you haven't come upon many examples of businesses that have, or individuals who've said, well, my business took me down to, I guess, 29 hours, is that right?
Well, there's definitely people who've said that, but we don't know how, I don't know how widespread it is.
Too soon to say.
Yeah, Bureau of Labor Statistics' latest reports, they were looking for this in the most recent numbers on full-time versus part-time workers, and they found no shift. Now, that's not a completely accurate economic study, but you would expect in the raw data that if the businesses were expecting to have an effect, they'd start switching to part-time workers.
You'd see something at least by now.
Yeah.
Erin, I mentioned that you've opened up an office for Young Invincibles here in Houston, and I commented to you on the way in that it was interesting you've come to Texas to do this, a state that has declined to embrace the aspects of the Affordable Care Act we're talking about. If your job is to put young people front and center in a debate over health care reform, it would almost make more sense to do it in a state in which healthcare reform is front and center. But here, we've declined actually to do that, so you have your work cut out for you, as they say.
Yes, definitely. Well, it's just like you mentioned, it's the most uninsured state of all 50 states, so there's just a huge, huge amount of need here. Right. Houston particularly has a very large young adult population, and I think that 41% of 18 to 24-year-old Latinos are uninsured in Harris County, which is just an astonishing rate of uninsured people. So
right. And so what do you do? So you come here, you set up this office, and then it's like, okay, get to work. So what is your, connect the two halves. So how do you connect that population, which is of course growing in Houston, Harris County, and in Texas? How do you connect them to the health insurance system in a way that turns those numbers around?
Well, we've been running a campaign that we titled Healthy Young America, where we've done kind of organizational trainings. We've done them for kind of a train-the-trainer setup, where we do it for other organizations who will then kind of disperse the information out in their communities. Now that open enrollment has actually started, we've kind of shifted to more direct consumer approach. We've been doing presentations at community colleges, things like that, as well as having a huge social media presence.
Right. But at the end, what you're trying to do is to drive people to sign up.
Right, right. They're just kind of giving them the information that they need.
But interestingly, for a state that hates the federal government coming in and doing business here, by not creating a state exchange, we did just that. We're now having to rely on the federal exchange. And some of the states that actually seem to create their own exchanges have fared better in this last couple of weeks than the ones that have relied, ironically, on the federal exchange. So it's a challenge for you that's exacerbated by that fact, is it not? Okay.
It's very frustrating right now, I think, for groups like Young Invincibles or any navigator or a sister group, anyone who's trying to sign people up, because they can't. I mean, they keep trying to, I've sat down with so many navigators and watched them try to get people through the online system, and it doesn't work. And yeah, you can sign up on paper, but those things have to go through some sort of electronic system eventually too. I mean, we're sort of at a standstill right now, unless the government can get the website figured out by the end of November. I mean, I don't know what's going to happen.
And they don't have very much time to do it. As we sat here today, we talked about this before we came up on stage, the Republicans in the U.S. House released a report that said, leaked some documents that said that on the very first day that the Affordable Care Act went online, a total of 6 people, not just 6 people in Houston or 6 in Texas, 6 nationally, signed up for health insurance through the website. 6.
I mean, they ran a test in the early days of the website right before it went online, and they had 200 people trying it, and the site crashed. So, you know, factor that out, how many people are trying to get on now, those problems still exist, it's hard.
So in that respect, Dr. Ho, whether this panel was healthcare and the millennials, healthcare and seniors, healthcare and Latinos, the fact is that the barriers to sign up kind of pollute any conversation because it masks, those problems mask what may be the real obstacles to getting people into the system.
Well, yeah, so absolutely this is a problem that no one can sign up, but what I'm really worried about is this is going to exacerbate the challenge of trying to get the young invincibles to sign up, because who's going to want to sign up the most? The person who's got a pre-existing condition and knows that they're going to need health care. And someone who's on the margins like, yeah, maybe I need this, maybe I don't, and just, tries the website 3 times.
Well, if, human behavior, if I get kicked off of Amazon, I'll just go buy the book on iBooks, right? I mean, that's the way we go. And if we tend to be impatient, all of us in this world, maybe younger.
Especially if you're young and you're used to having wonderful websites, and then you go try to sign up for something on a site that looks like it came from 1998. And maybe if you really need health insurance, you will try repeatedly to get in. Like Dr. Ho is saying, you might try 15 times and be able to sign up for an account. But the people who are really going to push and try are the ones who really, really need health insurance, either because they're sick or because they're older, and they're just going to bring the cost of premiums up. They need to be brought down in turn by younger people. So what that means is that'll affect premiums in 2015. When health insurance companies go to look at what their risk pool looked like in the previous year and set the rates for the following year, 2015, that's when you're going to see the rates going up. And that's what everyone is really worried about.
Right.
But I'd also like to say that the website's going to get fixed, right? It's a website, and I was just having a conversation before, like, it's funny that the two storylines right now coming out of the government are, one, oh my gosh, the government is technologically amazing with the NSA, and then the government is like technologically failed with this simple, not simple, it's actually a complicated website,
but
to be fair.
Maybe, I think you've just come up with the answer. Maybe if we just agreed to spy on young people, all this would get fixed.
So, but the website is going to get fixed, whether it's now or in December or January. Maybe they'll change the enrollment period, maybe they'll change the mandate period. I think that's going to get fixed. I think the bigger question is, are these plans actually affordable for people? Do they consider them affordable? And are they going to want to buy them? I think that's actually the real question.
In the end, cost,
that's the real question. Is this really Affordable Care Act?
For your folks, in the end, cost really, it's the affordable part of the Affordable Care Act that matters.
Yeah, I completely agree. I mean, obviously the website needs to get fixed, and it will eventually, but again, the young and healthy people who are going to need the extra motivation to go on the website to begin with weren't the people who are trying to do it on October 1st. So I think that some of that, procrastination, these people are probably just kind of waiting it out anyway. I mean, they know they have until March.
They have other things to do.
Yeah, and I think that, some older people might understand the internet too, but young people tend to be internet savvy. They understand that websites will get fixed. They're not going to be deterred.
You think they're going to be more forgiving?
Exactly.
Got it.